It's like my work is already done. 3 years ago, December 2019, my family and I moved to Minnesota. Now, if you know anything about Minnesota winters, you might already be laughing in your mind. Who moves to Minnesota in the middle of winter? Or what I thought was the middle of winter. Turned out it was only the beginning. I did. When my family and I arrived that day, that -5-degree cold air didn't bother me at all. It actually felt like an embrace. I was so excited. I had just graduated from The Ohio State University and had accepted admission into a Master of Public Health program at the University of Minnesota. I was super excited because I was tired of the talk about health disparities, tired of hearing about all the promises, all the terrible outcomes. I was ready to get things done and do something about it. And Minnesota is the place that makes things happen. Well, my goal was to solve racism and health disparities in just 2 years. That was my goal. What happened next will be in the history books, but I'm sure you remember. By Valentine's Day, there were whispers that the COVID-19 pandemic had reached our states. By St. Patrick's Day, this school and many others were closed down completely, grocery shelves completely emptied of groceries and toilet paper. By Easter, I was getting reports that 1,000 people a day were dying in my home state of New York, where the majority of my family still resides. And by Mother's Day, I wasn't sure at all what kind of life my 3 children were to inherit. And then May 25th, Memorial Day, just about 10 miles from where we gather, George Floyd was murdered. And once again, because this was not the first time, we had to grapple as a city, as a state, as a nation, and as a world with the blight that racism is reaping on to Black, Indigenous, and people of color. In response to the murder of George Floyd, the Minnesota House passed a resolution declaring that racism is a public health crisis, something that Black people have been trying to say for a very, very long time. But from a public health perspective, I wanted to know, how would healthcare organizations respond to this health crisis? What would they do to engage with community members? What would they do to make sure that things like this do not happen again? Yes, addressing racism even inside of the COVID-19 pandemic. Well, on May 28th, several CEOs of healthcare organizations joined together to develop a joint response to the murder of George Floyd. And in it, this is what they said. This is an excerpt from that letter. "We are committed to taking steps to eliminate the repeat of events like this, the murder of George Floyd, in our society, and committed to investing substantive change in our organizations and the communities we serve to address racial inequities and social justice. Change has to start today, and it needs to start with us." So I have 2 questions for you all. Do you know if the place where you receive care helped to develop and sign this statement? And more importantly, do you know what your healthcare organizations did to fulfill this statement? I can tell you, very, very few of us actually know that. Though we understand that health is determined and created by big social structures that happen far before we see a doctor. Social structures like education and the environment, both built environment and climate environment, economic stability, all of these are either adding to or detracting from health. But we don't always know what healthcare organizations are doing to create good environments that foster good health in communities. Not only that, we don't always know what is happening inside of healthcare organizations to create safe, high-quality environments for all people, specifically people of color. We don't know what is being done to address the implicit bias that can occur. We don't always know what is being done to make it safe for Black women to give birth in some of these organizations and healthcare settings. We don't even have price transparency in our healthcare system. I mean, where on earth do you use a service and only find out how much it actually costs until you get that dreaded explanation of benefits letter in the mail, and then you learn how much you actually spent at the doctor? My point is, there is a lack of transparency between community, healthcare consumers, and the healthcare organizations in which we receive care. But systems of non-transparency and non-accountability are built and designed. They don't passively happen. And the good news is that we can use innovative design to build transparency into our relationship with healthcare. My talk today is a little bit different than other TED Talks. I'm actually pitching an idea to each of you, and I'm asking you to dream with me for a moment. So, are you with me? Yeah. All right. Awesome. Introducing Transparency in Medical Equity Certification, or what I'm calling T.I.M.E certification. Now, like I said, I'm pitching an idea. It doesn't already exist, so we can work on this name together later. The T.I.M.E certification could exist to do three key things. First, it sets a high bar for health equity actions within healthcare organizations. One that invites and challenges healthcare organizations to do work outside and inside. And it sets a high bar by producing a robust assessment, hearing how they are developing strategy to address some of these disparities. After they assess an organization, they then score organizations based off of how well they are implementing health equity action inside and outside. And then, and the most important part, that score is communicated back to healthcare consumers like you and like me, because we need that transparency. And what good is all of this work when it's happening inside of organizations if we don't know about it? Now, I am about action. I'm not about admiring the data. I think I've already kind of explained that to you. But if you're wondering why health disparities is such a huge issue, or if it's an issue at all, there are about 24 TED Talks that beautifully explain what the issues are. A quick Google search can show you almost down to the zip code, down to your zip code, what kinds of inequities are occurring within our society. The truth is that health is our greatest resource, but it is unequally distributed across populations based off of arbitrary and social constructs like race. That's not something I learned in my degree. This is an embodied truth, a lived experience. See, my mom was born and raised in Gonaïves, Haiti, and when social and political unrest occurred, my family moved to Lower New York to experience a better life, which, yes, included the pursuit of wellness. On my dad's side, my great-grandfather, William Williams, moved his family out of Orangeburg, South Carolina after, and I quote, "There was a lynching on the hill over yonder." He packed up his daughters and his wife and moved to Lower New York, and the generations continued, and then I was born. So the Better Life stories, maybe you're a part of a Better Life story too, with Minnesota's rich history of Swedish and Norwegian, Russian and Hmong, Somali migrants making our way, settling here on this Dakota land. Maybe you're a product of a Better Life story as well, but better turns bitter when every time I've walked into a doctor's appointment, every time I've used an urgent care, or each time I gave birth to one of my 3 beautiful children, I wondered, am I safe here? That question is unfair. And I believe that we need something that communicates to each of us, but especially those who are minoritized and marginalized in our communities, that yes, we have done the good work inside and outside, and you are safe within our organizations. Racism is a system of structuring opportunity and assigning value based on social interpretations of looks that unfairly disadvantages some while advantaging others, and this is my favorite part, and yet it saps the strength of the entire society through the waste of human resources. So yeah, white brothers, yes, white sisters who are actually Italian and Swedish and Norwegian and multicultural in your own identities, you too are losing something precious, something sacred, something worthy, something that would only add to our collective strength. How might something like a robust certification in the healthcare systems allow us to eliminate the waste of human resources? We humans aren't the only ones who are losing here. According to the CDC, the healthcare industry is a $3.8 trillion, and that's trillion with the T, trillion-dollar industry. And yet, because of health disparities and the loss of productivity, we have wasted $42 billion, and that is an annual number that does not actually capture the amount of economic loss and monetary loss due to premature deaths. This is a serious thing that we are all losing, and every time we lose a life, and every time we lose potential, we all lose strength. It's something that needs to be addressed. How do we know that something like a certification would be effective in eliminating waste and communicating to communities? Well, we've seen certifications work, seals work in the past before across other industries. The Green Seal allows us to think through where we want to spend our resources and make purchases based off of the environmental impact of that product or service. And my favorite, the B Corporation, has a robust assessment that proves that the organizations that earn that certification are of benefit to the society. That is what B certification means. We all use healthcare, and yet no formal community-facing seal exists that raises our confidence in the quality. It is actually a major gap that I believe could answer so many questions and put all of our minds at ease. So you might be wondering, okay, healthcare consumers are only some of the stakeholders. What do healthcare organizations think about an idea like this? Well, as a part of my final project in my master's, I decided to follow up with the healthcare organizations that wrote that letter, that joint response to the murder of George Floyd. I wanted to know, what actions have you taken? Which ones have you not taken? What have been facilitators or barriers to taking action? How can public health help you in this pursuit? I was hurt. I was jaded. I was expecting to hear that very little action was taken. What I actually learned through these interviews is that we have some of the most curious and passionate, teachable leaders within our healthcare spaces. They did do actions. They poured millions of dollars into resourcing Black-owned businesses. They wanted to ensure that low-income families that did not have access to Wi-Fi were able to do so they set up centers. They did all kinds of things. And still, when I asked them, on a scale from 0 to 10, how effectively do you think you lived out that statement? Most of them said 2. They said, we have a long way to go. We're proud of the work that we're doing, but this is only the beginning. We're trying to figure it out. We need all hands on deck. I was proud to see that action was taken, but I also had 2 questions. Do the actions accurately reflect the demands of the community? And after actions were taken, did they report back to their patient population what the outcomes have been, what they're hoping them to be, the trajectory of outcomes? If you receive healthcare in this state and you don't know the answer to those questions, then you have the answer. More must be done to communicate what actions are taking for anti-racism and health equity. More action must be taken to place us, the healthcare consumers, back at the center of what we're doing. Because change does have to start today. They were right about that in that part of their letter. But it actually starts with us. Our interests need to be at the forefront of all health equity strategy and design. So here are 3 action points that I'm hoping healthcare leaders who might be watching this or might be in the room consider. Number 1, when you're designing your health equity strategies, is it human-centered in its design, or is it designed around your bottom line? Who is at the table who's at the table when it comes to developing the strategic priorities around health equity? Who's in the C-suite in the first place? How do you amplify the desires and the interests of community above the interests of business, healthcare business? And lastly, how are you communicating back to us? Because when we walk into your healthcare organizations, one of the first forms we receive is an informed consent sheet that we need to sign. But only the truly informed can truly consent. And when I walk into a doctor's office, I want to know that I'm safe here because I know that robust work has been done for health equity and anti-racism. That I'm going to receive the same quality of care that someone that looks differently than me will receive. For all of the heartache that the year 2020 brought to us, it also brought an opportunity to operationalize the good intentions that we all felt, all of the podcasts, all of the think pieces that were written, and people just sharing out their intentions and their hearts and their commitments. But now it's time to take action. And since we are the place, the cradle of the revolution, and we're the cradle and the catalyst of a movement of accountability and transparency, it is only right that Minnesota lead the nation in a robust assessment that scores health organizations on actions and communicates it back to community. Because change starts here, the place is here, and the time is now. Thank you so much.